At number 10, we have things like acupuncture, CBT, and non-pharmacological and non-invasive therapies. Very modest benefit, if anything at all. Generally benign and safe. At number 9, you have devices like vagal nerve stimulators, peripheral nerve stimulators like the Cephally device, transcranial magnetic stimulation. Again, generally safe, but very modest benefit, if anything at all. Okay, at number 8, you have the supplements. Magnesium, riboflavin, which is vitamin B2, coenzyme Q10. So again, very limited in terms of how much benefit you're gonna get from those, but they tend to be safe, and for people who prefer supplements as opposed to a prescription medication or a procedure, reasonable option, but don't expect too much in terms of benefit. At number 7, you have the anti-seizure medications. So things like Topamax, valproic acid, Gabapentin, and Lyrica. So generally speaking, these are effective for the most part, but they are very limited by their side effects. Sedation, weight changes for some of them. And in fact, almost all of these medications have a nickname because of how bad the side effects can be. Like Dopamax for Topamax, Valproate for Valproate, Gabapentin or Morantin. So that tends to be the limiting factor for this class. All right, at number 6, you have the antidepressants as a class. So you have the tricyclics like Amitriptyline or Triptyline, and then you have the SNRIs and SSRIs, so things like Effexor, venlafaxine, Cymbalta, duloxetine. They tend to have some good benefit for prevention. However, they are limited by side effects like weight gain and brain fog and confusion and other ones. Now, for number 5, you have the blood pressure medications or other cardiac meds. So that includes propranolol, metoprolol. You have things like candesartan, you have verapamil. These are good medications. They tend to be generally well tolerated, but they come at the risk of cardiac side effects. All right, at number 4, you have the occipital nerve block, which is basically just one shot of local anesthetic and steroid for the occipital nerve, which is very highly implicated in migraine pathophysiology, right? One injection, usually every 3 to 6 months, which is good, right? But for some people, they don't like injections, and it doesn't necessarily work for everybody. Right, generally more favorable if somebody also has cervicogenic headaches coming from the neck. And now we're down to the top 3. So basically at number 3, you have the injectable or infusible CGRPs. So that's basically Emgality, Aimovig, Ajovy, and Vyepti, which is an infusion. They're generally very good options, excellent efficacy. However, they tend to be an injection or an infusion, which can be inconvenient for some people. All right, for number 2, you have the oral CGRPs. So that's basically Nurtec, rimegepant, and Qulipta, atogepant. Both are excellent options for migraine prevention. Very well tolerated, excellent side effect profile. Usually just nausea and some constipation. They're as effective or more effective than the injectable CGRPs, but significantly more convenient for use. And people usually can try it as a sample, unlike having to sign up for an injection or an infusion like it is with the other CGRPs. All right, and at number 1, not a surprise, but basically my favorite option for migraine prevention, which is Botox. Right? So excellent option, 60% reduction or more in headache frequency, duration, and intensity. Very well tolerated, almost no side effects, gets rid of the wrinkles at the same time. Just so many advantages to it, which I've explained in other videos. Were you surprised by anything on this list? If that's the case, comment below and let us know.